Hi, and welcome to my presentation on folic acid and neural tube defect prevention. To start off, I will introduce myself. My name is Dana Cole. I was born in Guangzhou, China, and I'm also Jordanian and American. I go to the American International School of Guangzhou, and I am a rising senior this year. So, have you ever noticed that in flour packages at the grocery store, it always says enriched on the packaging? And that is because the flour contains folic acid. But what is folic acid? Well, folic acid is a form of vitamin B9. Folic acid is synthetic, as it is a man-made version of folate, which is natural. And folate can be found in leafy greens like spinach and kale, or in beans, peas, etc. But folic acid is synthetic, like I said. We can take in folic acid from folic acid supplements or in enriched flours, but we need to take it in from external sources because our body cannot synthesize folic acid by ourselves. But it is a necessary vitamin for our body to create new cells. So what does this have to do with neural tube defects? Well, neural tube defects are fatal defects on the baby when it is born, and it is either a defect on the baby's brain, which is called anencephaly, or on the spine, which is called spina bifida. And these defects develop in the fetus only a few weeks into pregnancy. And folic acid is important for preventing neural tube defects to occur. It is important for the individual to take an adequate amount of folic acid before pregnancy and during early pregnancy as to prevent neural tube defects from forming in the fetus. And it is recommended for individuals to take 400 micrograms of folic acid each day. So how does folic acid help to prevent neural tube defects? Well, when we take in folic acid into our bodies, it is converted to tetrahydrofolate, or THF, in the body. And THF is a coenzyme in a reaction called one-carbon metabolism. And one-carbon metabolism is important for DNA synthesis or DNA repair, nucleotide generation, and nucleotides are just parts of DNA, and methylation reactions. And all of these are important for the proper development of neural tube, of the neural tube. And the neural tube will go on to develop into the spinal cord and the brain. And another fact is that some individuals hold a gene that affects their ability to absorb folic acid. So these individuals have to take in more folic acid than the average person. So I'm going to discuss how this discovery was made and how it ended up being a success in public health. So in 1965, researchers discovered a link between low levels of folate in blood and a higher risk of NTDs. So later on in the 1990s, they conducted two randomized trials on pregnant women, and these trials showed that women who were taking folic acid supplements actually had a lower risk of having a baby with a neural tube defect. So in the late 1990s, the government mandated the fortification of flour and grain products all around the country. So this graph shows the impact that this change has made, and as you can see, in this line separates pre-mandatory fortification and post-mandatory fortification. As we can see after this line, the NTDs per 10,000 live births has rapidly declined, and this graph just shows the impact that this change has made. However, I would like to note that these different lines, they represent different racial groups in the United States and it's clear that this change has affected them differently. And I will talk about this more later. Okay, so as with any public health issue, it is important to consider the social determinants of health before carrying out a change in policy. So, some cultural differences I think are important to know when discussing the implementation of folic acid in food products are cultural differences because a lot of cultures in the United States, flour and grain is not an integral part of their diets. Therefore, some cultures may not be getting enough folic acid. For example, corn flour is not enriched. However, many cultures in the United States do consume more corn flour than regular flour. And another important aspect to consider is that a majority of the population is not aware of this issue. I myself was not aware of this issue before I went out to actively research it, But it is important that people know that this is an issue so that they can actively go and try to prevent the development of neural tube defects. Um, Another factor that may prevent an individual from getting enough folic acid is social economic barriers. Some individuals may not have the financial freedom to prioritize buying folic acid supplements or taking in or buying enriched flours, etc. And lastly, nationality, because not all countries have a mandate on fortifying flour. The United States does, but a majority of other countries do not. And as I mentioned before in the graph, um, s- this clearly shows how different racial groups have been affected di differently by the fortification of flour, sorry. And that is why it is important to determine these social determinants of health when making a change like this. I feel like a common question when this is learned is why can't we just get more folic acid from natural foods? Why can't we just like eat more spinach? Well, first of all, 50% of natural folic acid, which is folate, uh, is absorbed by the body. So when you're eating spinach, you're only absorbing half of the folate in the spinach. But when you're taking in the synthetic version, which is folic acid, you can absorb 85%. And second of all, as you can see in this diagram here, natural foods are much less concentrated in folate, while foods made from enriched flours are highly concentrated in folic acid. For example, 1 cup of spinach only contains 58 micrograms of folic acid, while 1 bowl of pasta contains 140 micrograms. And 1 serving of General Mills cereal actually reaches the daily recommended amount, which is 400 micrograms. And there are some disadvantages and concerns with this change, as some individuals may take in too much folic acid. That's because if you're taking a folic acid supplement, which gives you 400 micrograms, and then you're going on to eat foods containing enriched flours or grains in the same day, you may take more than 400 micrograms. And this is not good because the liver can only process at a certain amount of folic acid at a time, and if there's too much, then there will be a buildup of unmetabolized folic acid in the body. And this can cause mental decline, the reoccurrence of cancer, and even the slowing down of brain development in children. So doctors have set a limit of 1,000 micrograms of folic acid a day, and it is important to be aware of how much you are taking. So in conclusion, the fortification of flour and grain products in the US has drastically declined the risk of neural tube defect, and there are still issues of accessibility to address and acknowledge, and to ensure that everyone is getting um, the right amount of folic acid each day. But I think that this is a really impressive act of public health, and I think overall it's been really successful. And yeah, here are my references, and I would like to acknowledge the CDC, the Centers for Disease Prevention and Control, because I learned about this issue from a lecture in its online summer course last year. And yeah, thank you so much.